Okay. All righty. So next up, a new thing that we're having for 2023, I came up with this, the mental health spotlight. And so each month we're going to have someone to speak in the mental health spotlight. And this month we have Miss Shanae Weems, and Shanae is from Riveredge Hospital, and she is a MHRM, which means Masters in Human Resources Manager. So Shanae is going to talk a little bit about mental health and also about the hospital services they provide and give information to the group. So Shanae, it's all yours, darling.
So I am preparing the screen. Hold on 1 second. I need to go ahead and share it out. All right. So as thank you for the introduction, Suzette. As she mentioned, I will be just kind of covering and highlighting Riveredge and our services and how to access our services. And you all learn more about Riveredge. For many of you on the screen, I know that Riveredge is not new to you. So hopefully you learn something new about our services and how to access it and make referrals. I am the community liaison, and specifically I cover the south side of Chicago and south suburbs. However, we have a team that covers the city of Chicago and state of Illinois, to be honest. On the screen there, you'll see some of the things that I'll be covering during this presentation. Talking about the services and programs as mentioned, going over the population that we service, becoming aware of the intake process and how to access our services, and then introducing you guys to Universal Health Services, which is the umbrella organization for Riveredge and many of the mental health hospitals in the state of Illinois, specifically in Chicago. As you'll see on your screen with the flyer, there's about 6 hospitals, including Riveredge, that fall under this umbrella. In the city of Chicago, most know of Garfield Park Hospital and Hargrove Hospital, which service children and adolescents, and then Hargrove service adults. And then you have more downstate, the hospitals Lincoln Park Prairie and the Pavilion, that also focus on children and adolescents, and the Pavilion services children, adolescents, young adults, and adults. And then you have Riveredge and Streamwood Behavioral Health Services, or Health Hospital, I'm sorry. One thing to note about Riveredge is that we service the full lifespan, and that's children starting at as young as age 3 through adult senior. That is one of the distinct, unique services that Riveredge has to offer, is the fact that we service that the geriatric population. All 6 of the hospitals, we work together in accessing and getting referrals. There is a little bit of friendly competition at times because, it's business, but at the end of the day, the main point is to get the services that's needed. So if there's a referral that's coming to Riveredge and bed availability isn't there, we begin to reach out to other hospitals that we know meet the needs within the UHS umbrella. Something a little bit more about Riveredge is that we are 60 years old in operation. The hospital started operation in 1963. Right now, we're currently the largest freestanding psychiatric hospital in the state of Illinois. And as I stated, we service the full state. We're located in the west suburban area of Forest Park, just outside of Maywood. So we are not centrally located. However, like I said, we service the state of Illinois, city of Chicago. We currently have a 210 bed capacity, where that's the number of bed capacity that we have. However, with the state of mental health right now, we generally operate at about 130 to 150 bed capacity. And that's based on the acuity level of the floor, the staffing, patient ratio on the units, things like that, dictates how we're going to function and operate. So while we have a 210 bed capacity, we maintain around 130 to 150. And then one thing to note about our hospital is that we are not a seclusion or restraint hospital. We do use trauma-informed care and practices in order to engage with our clients. So shared beliefs, we believe in healing and recovery. We believe in every individual has the right to be treated with dignity and respect. We believe in providing quality care in a compassionate and therapeutic manner. We take these beliefs very seriously in how we engage with from the start of the referral all the way through the discharge and maintaining with our clients. So our services, we have the traditional inpatient services, which I'll go a little bit more in detail with all of these services. Inpatient services, outpatient services, which includes partial hospitalizations for children and adolescents. Intensive outpatient services, which I'll talk a little bit more about, and then your traditional outpatient service, which just means your traditional therapy, the weekly 1 hour a week session with the therapist. We provide no cost level of assessment, level of care assessments. So that's your initial assessment to understand and get an idea of where the patient or individual is in their mental health needs. We provide medication management for children, adolescents, and adults. And then we also have a residential treatment center for teen boys dealing with sexually aggressive behaviors. And we provide community education. There are 2 ways that we offer community education. Some of you may be familiar with our Rise and Learn program, where we have monthly workshops in partnership with CIS communities and schools to offer various program training opportunities and CEUs to clinicians every month. I'll be at the end of this presentation, I'll actually show you guys the one for February that we'll be hosting in a couple of weeks. Most of our trainings are at minimal cost, at minimum 10 for the Rise and Learns, and they're still currently virtual. And then another way that we offer community education is through our Riveredge University community workshops. These workshops are free to community agencies, schools. We have presentations that we'll be presenting in libraries, in any entity outside of the hospital that wants to have community, have mental health awareness workshops. Some of the workshops include like stress management and coping strategies, suicide education and prevention, race and trauma, for supporting students and families, mental health 101. We just did a self-care workshop for educators at the University of Chicago Woodlawn campus yesterday. And these workshops are free. So these are this is another way to get information out there around mental health support and awareness. So when we talk about an inpatient program, this is your traditional hospital stay. This is a short-term stay on average of 7 to 14 days. We are not a long-term hospital facility. One thing to note about Riveredge is that we are not a medical surgery center. So if there's medical needs that an individual have, it must be cleared. Adults must be cleared medically in order to be admitted into our hospital for services. And then if there are medical needs that arise throughout, we are in partnership with Loyola Hospital, which is right down the street from us, to manage those things. So we're talking cardiac arrest or any type of medical emergencies that come that come into play. We have 7 units throughout the hospital servicing, again, children and adolescents. So when we talk about our children and adolescents floor, children started again at age 3 to 12. They participate in child-focused therapeutic strategies, which I'll talk a little bit more about. They have family engagement opportunities. We used to have family visitation opportunities prior to COVID, but since COVID, those family visitations have been paused, and they're still on pause, but they are able to communicate with families through the telephone. So they're able to talk to their family members and things like that. We also partner with the schools that the children and adolescents are attending in order to get information about their schoolwork, to keep them on track. Each participant or each unit has an hour of education where they're able to still engage and stay on track academically. When I first started at Riveredge, I had the opportunity to observe on the adolescent girls floor. And during that time, they were in group. They were, doing the education part. And I was able to witness one of the young ladies who may have been I think she was a senior. She was, we had the Chromebooks that they were able to access on Chrome. And she was, really concerned about keeping up with her work and staying on track for graduation. And I just, that was what I witnessed in our observation for the conversation. So they all had time where they kind of rotated. It was like 4 or 5 laptops. They rotated out, did the work that they needed to do in that time frame, and then went back to other assignments if they didn't have to be on the computer. So this is an opportunity, like I said, we partner with the education system in order to still be able to keep the young people on track while they are receiving services from us. We have bilingual staff on all units and in the treatment teams. When we talk about bilingual, we do mean English and Spanish speaking, but we also have, if necessary, a translation service that is HIPAA compliant in order to help provide services to individuals that need it as well. So now we talk about our outpatient services. Partial hospitalization is a service for children and adolescents, specifically Monday through Friday from 9 a.m. to 3 p.m. This gives them this is for individuals that mental health needs, they either have stepped down from our inpatient programming to partial hospitalization, or initial entry into the hospital is through partial hospitalization programming. Their mental health needs are not as acute in order to be for inpatient stay. So they come to the hospital Monday through Friday during that time frame where they're receiving education and therapeutic services throughout that school day. They, for whatever reason, are unable to maintain within the classroom setting. So we bring them out of the classroom setting into the hospital setting to address their mental health needs, and also still give them the education that they need in order to stay on track. Then we move into intensive outpatient services. This is, you have your traditional outpatient services, which I mentioned before was your weekly 1 hour a week session. But then we move into intensive outpatient, where that could be individual therapy that is meeting 3 hours out of the week rather than 1 hour out of the week, or they're engaged in intensive group therapy. So you see the flyer on the screen for our in-person adult intensive outpatient programming, and the topics that they cover during this programming: depression, anxiety, bipolar disorder, PTSD, and then psychological trauma and abuse. Those are just some of the groups for adults. Then we have some group sample groups for our adolescents. You have adolescents dealing with life issues that happens on Saturdays, 2 sessions on Saturdays. You have supporting children with ADHD. You have art therapy groups We have medication management groups. Again, we provide medication management for children, adolescents, and adults. All of our groups have open enrollment. There's a comprehensive outpatient assessment that is completed. And then those assessments are billed to the insurances. One thing I didn't mention, so since I'm saying insurances here, let me backtrack. The hospital, we accept most of all insurances. We accept Medicaid and Medicare, long as they're managed plans. We are unable to bill directly to the state. So as long as it's a managed plan, we can take Medicaid and Medicare, and that includes county care. And then medication management groups are co-led by psychiatrists and advanced practice nurse practitioners. So some of the reasons to consider Riveredge when assessing services and where you want to send your loved one, or where you want to go if you need mental health care. We practice trauma-informed care. We use evidence-based treatments such as cognitive behavior therapy. This is, goal-oriented therapy to help manage those mental health needs, generally done with depression, generally used with depression and anxiety. We have behavior therapy, and that is the behavior that is therapy that's targeted to kind of self-guided or self-determined changes in unhealthy behaviors that they experience during their mental health crisis. So we use evidence-based treatment. We have an excellent clinical staff and team, and we are considered a suicide safer hospital. So we operate off of zero suicide, not attempts, but zero suicide issues. So we are really focused around that. Some of the accreditations that we have, we are a part of the Joint Commission's accreditation. We've received Service Excellence Awards through the Universal Health Services organization. We are part of the Chairman's Council. We have the Chairman's Council Award, and we are SAMHSA. We received the SAMHSA Technical Assistant Grant for Clinical Excellence. Again, talking about our our type of treatment and quality treatment, we have our interdisciplinary teams. As you can see on the screen, we have our teams include physicians, that's your psychiatrists, advanced practitioner nurses, nurses that are RNs, LPNs, therapists, mental health associates, dietitian, and educators. That there's a team assigned for all 7 units to service the individuals within the hospital. And then you have the therapies that we just mentioned in the previous slide: cognitive behavior therapy, behavior and advanced therapies. And then we also use expressive therapy. So that's your dance and movement, art and drama. If you've ever had the opportunity to visit Riveredge or have the opportunity to visit Riveredge in the future, you'll see that our hospital is decorated with a lot of the artwork from our past and current participants and patients. We've partnered with NAMI, which is the National Alliance on Mental Health Alliance, where they have a peer recovery specialist that comes out and run groups on our dual diagnosis unit every week as a individual that has gone through the recovery process, and they come and they spend time with our participants or patients on our dual diagnosis unit. And then we have the adjunct clinical services such as pet therapy. We currently are on pause with the pet therapy. I've been at Riveredge since August, and I haven't had the opportunity to see this particular program in action, but I've heard a lot about it, where they would have service animals, service dogs come and spend time on the unit to, just provide a little bit of extra love and affection to the patients on that particular unit. So here's the general contact information for contacting Riveredge. There's 3 ways to contact us. That you can contact us in accessing referrals or requesting a referral. Some things to note about requesting the referrals: it doesn't have to come from for children, it doesn't necessarily have to come from SAS. For adults, if you're an individual and you feel that you need services, you can request a referral yourself. Family members can request a referral or an assessment or level of care assessment. And you can do so by, again, using the QR code, going directly to our website, or calling. We are a 24-hour, 7-day-a-week facility. Our intake team is available 24 hours